In March and April of 2020, U.S. consumer spending on healthcare dropped year over year for the first time in 60 years. That's according to the nonprofit Kaiser Family Foundation. At least $2.7 billion a week in run-of-the-mill health spending just evaporated. The cause was the pandemic. People had been told to stay home and were afraid of becoming infected. Even if they wanted to go to the doctor, in-person slots were scarce as waiting rooms were thinned out to allow for social distancing. These disruptions, compounded by job losses that added to the ranks of uninsured Americans, have created a shadow health crisis. Here to discuss more is Bloomberg health reporter Emma Court, live in New York. Emma, thanks so much for joining us on this really important story. To take us through some more numbers here, what are the indicators that we saw in 2020 that indicate that people have put off going to the doctor?
Hi, thank you so much for having me. I think the numbers you highlighted at the start are kind of tell the most compelling story about how dramatic this change was that happened in the early months of the pandemic. And we really have seen a recovery in terms of people accessing medical care since those initial months. But if you look at the charts, it tells a really compelling story because you see that people are going back to the doctor and that telemedicine, these virtual care visits did take off during the pandemic, but you're not seeing it totally make up for that deficit, that gap that occurred, especially in those early months. So something that we've looked at to try to understand what the impact of this sort of profound disruption in terms of routine medical care had was looking at something called excess deaths. You probably heard a lot about it during COVID because this is something you use when you don't have a lot of information and you're trying to make sense of what's been happening. And so, we know that a lot more people obviously died, sadly, this year from COVID-19 based on, what you would expect on using kind of historical averages. But we also know that almost more than 100,000 people died last year through December of non-COVID causes as well. These are excess deaths, so these are more than you would expect based on the past. And we know deaths from two kinds of heart diseases also increased in several states in the early months of the pandemic as well, based on some studies. So we have some of these numbers starting to come in, telling the story about what occurred this past year, but we really don't have the full picture yet because these are things that are going to take a long time to come in. There are a lot of different layers to this, right? If you miss a primary care appointment this year, is it possible that you will get a cancer diagnosis next year? It's possible, but we don't totally know, and we hope not for sure. And then there's this other layer of these chronic conditions like diabetes and hypertension. They need a lot of care and a lot of monitoring. And if you miss a doctor's appointment or you don't get prescriptions filled, things like that, what impact will that have on your quality of life, on your health moving forward? We don't totally have those answers yet in the aggregate.
There's also the element that you write about in this piece, Emma, that talks about the way that, of course, the COVID-19 pandemic has disproportionately affected communities of color, but this secondary health crisis that you write about not going to the doctor, it does risk exacerbating those racial health inequalities. What evidence are we seeing for that right now?
Right. So this is a really kind of important element of even just understanding COVID-19 and the toll it's taken to date. So we know at least one factor, and it's a complicated reason, but going into what has occurred, the heavy toll that COVID has taken on communities of color is at least in part due to this sort of prevalence of chronic medical conditions in these communities. Because we know if you have other medical conditions, right, we've heard it over and over again during this pandemic, you could have worse outcomes. You could be hospitalized, you could die from this disease. And so the flip side of this is during this profound disruption to routine medical care, we do worry about access to care, especially in communities of color, low-income communities. It's not totally clear how access has sort of panned out during the pandemic, but we have some early indicators that it's not going so well. So for instance, New York City, where I know we're both based, had a program in the early months of the crisis last spring where they looked in the data and saw this early trend that we now know is very well established between communities with high levels of chronic conditions and communities that had this big toll from COVID-19. And they actually reached out to providers in those communities and said, are you still, are you still open? Can you put us in touch with your patients? And they found in a lot of cases, providers' offices were closed. They didn't have PPE. They had to furlough staff. They weren't totally sure how to do these digital medical appointments. And so the city tried to connect them with different resources to help with that. But I think you get a picture of how in the confusion of the initial COVID rush of these services weren't always available. And then the question is, when you talk about telemedicine taking off during the pandemic, insurers and employers have really tried to broaden access to this. It's a great way to get to the doctor without being worried about getting infected. And it can be very convenient, but it's not always convenient if you're someone who doesn't have great access to a computer, to a smartphone, you don't have reliable Wi-Fi, you're not comfortable with the technology. And so these are issues that come up a lot. I spoke with a clinic in Baltimore. They treat a lot of patients with HIV each year, and they said this telemedicine isn't working as well for them because of a lot of these barriers.
Yeah, Emma, it's the same thing that we're seeing, of course, with remote learning and communities that don't have the same access to high-speed internet and technology that makes remote learning even possible. Emma Court, we have to leave it there. It's a really important story. Thanks so much for joining us this morning on Quick Take. We appreciate it. That's Emma Court, healthcare reporter right here at Bloomberg News.